Cynthia Prescott, and I work at Sanctuary in downtown Toronto. Currently, I'm acting as our pandemic manager. At Sanctuary, we describe ourselves as becoming a healthy, welcoming community in which people who are poor or excluded are particularly valued. And in this season, the people who are most excluded are people who don't have a home, as you've heard about in previous weeks. In this last week, as the province has begun to open, we found that many of the services for my friends have stayed closed, including libraries, public washrooms, and community centers. Another example is that Toronto usually has more than 50 organizations who do daytime drop-ins in a week, and now we have less than 15. So at Sanctuary, we've doubled our drop-ins, serving about 2,000 meals weekly. We've also found that as shelters don't have the physical space to do 6-foot distancing from all their residents, the city has offered and promised to provide alternate housing. But that option has been slow and piecemeal, and many people still are way too close to each other. And so many of my friends have left the shelters for their safety from the virus. What that's left us with at Sanctuary is an encampment that has more than 60 residents between our property and the park next door to us. Having an encampment that size has been complicated. It's been challenging, it's been overwhelming, and it's also been full of unexpected and extraordinary beauty. We've had to become very creative with our infection control methods, including renting 3 porta potties with sinks so that people have places to wash their hands. And this week, we're delighted to announce that Women's College Hospital is going to be providing whole community screening for coronavirus. And that will help us with 3 things. The first is we'll be able to figure out the effectiveness of our infection control efforts. The second is we'll be able to provide care for our folks who have the virus. And then finally, we'll be able to do contact tracing to reduce the spread of the virus in our whole city. Unfortunately, the city is still threatening to evict encampments. Despite recommendations by the American Center for Disease Control that says dispersing people who are living together in encampments actually increases the risk of community spread, right? Because it's the opposite of shelter in place. Some of our folks have been housed by the city, which we're incredibly grateful for, but there's been some challenges in these new short-term housing. The plan for that housing was that it was going to be harm reduction, but there wasn't space or strategies specifically for safe opiate use. And so we've had a community member die of an opiate overdose in one of them. So there's some things we urgently need from this city. We need a commitment to not clearing encampments until this pandemic is declared over by the World Health Organization. We need people living in encampments to have city-provided washrooms, hand washing stations, showers, laundry. So all of the basics that can keep people living in a dignified way and in a safe way. We also need the city to rapidly acquire more property for short-term housing. And all of that housing needs to have well-defined, community-led harm reduction options. Finally, in the long term, we need rent control, as you heard about last week. We need a reinvestment in social housing, and we need a clearer national housing strategy. So what can you do in the middle of all of this? Well, last week Angie Hawking mentioned our website, faithinaction.to, and I'd encourage you to go there, sign our petition, learn about the issues, and share on social media. And if an encampment moves to your neighborhood, you can explain to your neighbors why people have left the shelters and why clearing the encampment is a bad idea. You can offer food, water, or fire extinguishers to your new neighbors in the encampments. And when you go there to offer them those things, you can ask them what else that they need for safe and dignified living. Thanks for listening, and thanks for caring so much about the most vulnerable in this pandemic.
Hi there. My name is Amber Kellen, and I'm the Director of Community Initiatives, Policy and Research at the John Howard Society of Toronto. So the John Howard Society is a nonprofit organization, and we work mostly with men who are in jail and also those who have been released. And the most of our work focuses on reintegration and providing support for people once they have been released from custody. We understand that there have been a very small number of cases. However, not too long ago, the Ontario Correctional Institute in Brampton closed down entirely because they had an outbreak, and many people within that population were actually transferred to the Toronto South Detention Facility to try to make some more space. So here in Toronto, for example, we are home to the largest remand facility in Canada, at capacity 1,630 people. We know from our own research that once they're at the time that they're released, about 33 to 44% of them will have no fixed address. So we know that generally people in this particular facility have been charged but not convicted. So technically they're innocent. Most of them have not yet gone to court. They've not been sentenced. A typical example of what's been happening is, we have a supportive housing program, and we're able to offer people sometimes subsidies to be able to live in our spaces. And this one individual was homeless, and that is usually the eligibility for most people in our housing program. He was released from custody, and he had come and went to a shelter, and the shelter where he was staying actually had a COVID outbreak. So he was a close contact of someone who tested positive, and so he went to the city's special hotel site where they have people who are under investigation. And so he stayed there for just over a week, I believe, and eventually we were able to determine that his test was negative. He was tested, he was negative, but there was a period of time where we weren't sure. So we had to make an arrangement to hang on to his room before he was able to move in the case that he had to be kept in an isolation hotel. Fortunately, that didn't happen, and we're happy to say that he arrived today and he has moved in. Food security is an ongoing issue. Many of the services, programs, food banks, even safe injection sites have been shut down, some of them temporarily, some of them we're not certain if and when they'll be reopened. So getting food to our clients was a huge issue in the first days of the pandemic. Until the 12th of March, we had a small trailer, a converted camping trailer actually, in the parking lot of the Toronto South Detention Facility. And from there, we were able to meet with people immediately upon release. Prior to the pandemic, we'd been seeing about 100 people per month, most of them with no fixed address. We had to close that site in March, as I mentioned, because it's so small that there wasn't enough space to allow for social distancing in that area. So we know that we have to get back there as soon as possible to assist people. We know that although there are fewer people inside, some of those who are still in custody, because we hear from them every day, we still collect calls and we still have a toll-free number, are really fearful about what's happening on the outside in the community as far as COVID goes, have limited information about what's happening on the inside. The most important thing for us to know right now is that, while this is a very terrible time in many ways, there are also some important opportunities. And I think that when it comes to the development of transitional housing, more affordable housing for vulnerable populations, this is an opportunity where the things that we're now able to access because of this crisis, we have to be sure that they're sustainable. We have to hold on to all the ground that we're able to have right now, all of the progress that we're able to make, so that when this crisis ends, and it will, John Howard will still be here to help people who are transitioning and who are looking for assistance and who need help. So if you have any questions, please don't hesitate to call or email me, and thank you so much for your time.
Hello, I'm Marie McCormick. I'm the Director of Fundraising and Communications for Fred Victor. Fred Victor is an organization helping people who are homeless and experiencing poverty in Toronto, and we've been around for 125 years. Even before the COVID-19 pandemic, we were in the midst of a homelessness crisis. There are over 9,000 people in our city who are homeless on any given night, and 160,000 people, probably more, waiting for affordable housing. Affordable housing is out of reach for so many, and the shelter system has been at capacity for years. What the outbreak of COVID-19 has done is demonstrate just how precarious the lives of homeless people really are. One fellow I spoke to told me that he had lost everything that made his day livable. Gone was the library where he could read the paper and use the washroom. Gone was the coffee shop with the nice lady who let him sit for a long time with 1 cup of tea. Gone was the drop-in center where he could connect and be with his friends, play a game of cards and grab a sandwich. Gone was the clothing room where he could get a pair of shoes and a raincoat. I am so lonely, he said. I don't know if I can go on. Another woman I spoke to, she thanked us for delivering groceries to her and her neighbors. As a single parent of 3 little ones, I just can't go into the grocery store, she said, and the food bank near me has closed down. And then there's the young man who Fred Victor staff recently got an apartment for, but he had to isolate for 14 days. And he didn't have a computer, he didn't have Wi-Fi, he didn't have a phone. So he had no way to connect with the outside world. He had no way to apply for benefits that the government was providing. He had no way to call for help. So Fred Victor got him a smartphone, and 4 months of service. And so the first call he made was to his support worker at Fred Victor and his doctor, and they did a 3-way call together. And then his next call was to his sisters, who he hadn't talked to in many, many years. And then his next call was to us to say thank you. So all this to say that to stay open and keep people sheltered and safe, we are spending a lot of extra money on staff, on cleaners, on supplies, on food, on phones, and now that summer's on us, on fans and ways to keep people cool. So people often ask me how they can help. And first, it may seem obvious, but make a donation. Every gift makes a difference. Yours, along with your neighbors, adds up to the extra funds we need to buy all those masks and gloves and cleaning supplies that we have to order every day. It pays for the extra food and the frontline staff we need to keep people safely at home. Second, let's be friends. If you're on social media, like us. We post news and updates regularly on every platform: Facebook, Instagram, LinkedIn, Twitter. Follow us and share it with your friends. And speaking of friends, spread the word. Let people know about us. Let your friends and colleagues and family know about Fred Victor. Heck, you could even hold a fundraiser if you're really keen. Hopefully in a few months, we'll be able to open our volunteer program again, and you can come down in person and say hi. We'd really like to see you. Until then, stay home, stay safe. We're all in this together, and hopefully some long-term good will come out of all of this hardship. Thank you.